This lesson is concerned with the quality assessment of primary test accuracy studies using the QUADAS-2 tool. Assessing bias and applicability of included studies is step 6 in a Cochrane systematic review of test accuracy, but findings and quality assessment may impact on chosen analysis strategies and will inform interpretation of results and the conclusions drawn from the review. By the end of this lesson, you should know the components of an assessment of risk of bias and applicability of primary DTA studies, understand how to tailor the QUADAS-2 tool to a DTA review question, understand the process of making judgments about risk of bias and applicability as part of a DTA review, and appreciate the key considerations when summarising the results of quality assessment. We're now going to use a case study to illustrate tailoring of QUADAS-2 in Review Manager and the process of moving from scoring of signalling questions to making judgments about risk of bias and concerns about applicability. The case study concerns estimation of the accuracy of the ECG and a blood test, brain natriuretic peptide or BNP, for the diagnosis of heart failure in primary care. The target condition is impairment of left ventricular systolic function. This is the ability of the heart to eject blood into the arteries. And the reference standard is visualization of left ventricular systolic function using cardiac ultrasound. During this lesson, we will be defining the components of quality assessment of primary DTA studies, rehearsing the rationale for undertaking quality assessment, outlining the structure of the QUADAS-2 tool for assessment of risk of bias and applicability concerns, and using illustrative examples of how QUADAS-2 might be tailored to a review question. We will also be outlining key issues to be considered when presenting the results of quality assessment in a test accuracy review. The quality assessment of DTA studies comprises two distinct parts. Assessment of the potential risk of bias in DTA studies. This is covered in lesson 6.1, and assessment of the potential for variation in estimates of test accuracy across DTA studies caused by variation in study characteristics. This is covered in lesson 6.2. The purpose of quality assessment is to evaluate the effect of potential sources of bias on estimates of test accuracy, and to evaluate the effect of hypothesized sources of clinical heterogeneity on estimates of test accuracy. This is in order to guide our interpretation of review results in terms of the validity of test accuracy estimates and the applicability of a body of evidence to the review question. QUADAS-2 is a systematically developed checklist for assessing the quality of primary studies that evaluate test accuracy. The QUADAS-2 tool groups questions into 4 domains: patient selection, index test or tests, target condition and reference standard, and flow and timing. Assessment of risk of bias and concerns about applicability are treated as distinct components of quality assessment. This slide illustrates the basic test accuracy study design which was introduced in lesson 1.3. A series of participants undergo the index test, which is the test under evaluation, and also the reference standard. Bias and variation in estimates of accuracy can occur during the selection of participants, as a result of the conduct and interpretation of the index test and the reference standard, and as a result of the process of verification of index test results by the reference standard. Ideally, index tests and reference standard results should be conducted and interpreted independently and blind to each other. The flow and timing of participants as they move through this process is also a potential source of bias. For example, if some patients receive the index test but not the reference standard. Assessment of bias and applicability in QUADAS-2 is across 4 domains reflecting the stages of the typical test accuracy study design referred to in the previous slide. In each domain there are questions that probe aspects of the test accuracy study design that are known to be associated with bias. The QUADAS-2 checklist refers to these questions as signalling questions. Module 6.1 of the Cochrane DTA online learning materials provides detail about the sources of bias in test accuracy studies from which these core signalling questions originate. Authors can also access relevant QUADAS-2 supporting documents referenced at the end of this lesson. Note that assessment of applicability is not relevant to the flow and timing domain. Generic core QUADAS signalling questions about bias and applicability usually do not sufficiently cover review-specific issues because different review topics pose different challenges for evaluation of accuracy and therefore the potential risk for bias. This results in a requirement to tailor the QUADAS-2 tool to assist with judgments about risk of bias. Tailoring may include one or more of providing review-specific guidance about how to answer questions, for example modifying generic signalling questions by adding details specific to a review, adding signalling questions, or more rarely core QUADAS-2 signalling questions may not be applicable to a particular review. This slide illustrates the general structure of one of the 4 domains in the QUADAS-2 tool, the first domain concerned with patient selection. Note first the free text boxes. For the purposes of quality assessment, these free text boxes are used to record information on which signalling questions are answered. They provide transparency to quality assessment decisions. Signalling questions in the risk of bias section are answered yes, no, or unclear in order to guide domain-level judgments about risk of bias. High risk of bias, unclear risk of bias, or low risk of bias. Note that for the applicability concerns section there are no signalling questions. Tailoring in the form of adding questions is always required to help with judgments about applicability of included studies to the review question. This slide illustrates what a completed Domain 1 might look like in Review Manager. Details about patient sampling are recorded in the risk of bias text box. These details are used to inform scoring of risk of bias signalling questions, yes, no, or unclear. Details about patient characteristics are recorded in the applicability text box to help make judgments about applicability, low, high, or unclear concern. The contents of the text boxes are used automatically to populate the study characteristics tables in Review Manager. We're now going to use a case study to illustrate tailoring of QUADAS-2 in Review Manager and the process of moving from scoring of signalling questions to making judgments about risk of bias and concerns about applicability. The case study concerns estimation of the accuracy of the ECG and a blood test, brain natriuretic peptide or BNP, for the diagnosis of heart failure in primary care. The target condition is impairment of left ventricular systolic function. This is the ability of the heart to eject blood into the arteries. And the reference standard is visualization of left ventricular systolic function using cardiac ultrasound. Let us now look at how we might answer the risk of bias signalling questions for Domain 1 based on this information. A consecutive sample of patients were recruited, so the response to the first signalling question would be yes. The sample were all patients suspected of having the target condition, heart failure. They were not comprised of a sample of cases, patients with known heart failure, and a separate sample of controls, participants known not to have heart failure. Therefore, a case control design was avoided. The response to the second signalling question would therefore be yes. You can refer to Lesson 2.2 and 6.1 for further information about case control studies and how they introduce bias. The information provided suggests that all consecutively recruited patients suspected of having heart failure were included in the final analysis and there was no evidence of exclusions, so the response to the third signalling question would also be yes. Note that signalling questions are worded such that a yes response consistently indicates a positive attribute of a study, therefore lowering the risk of bias. We're now going to look at ways in which QUADAS-2 can be tailored to a particular review. Often core signalling questions do not adequately cover issues specific to a certain review and need to be tailored. In the heart failure review case study, one of the index tests, BNP, is raised in individuals with renal impairment, renal failure, and those who are taking diuretic treatment. This occurs independently of whether heart failure is present or not. Renal impairment and diuretic treatment are common in individuals suspected of having heart failure. Therefore, excluding individuals with these comorbidities will result in overestimation of the specificity of BNP. Clicking on the Properties box in the top left-hand corner of the QUADAS-2 patient selection domain provides options to tailor signalling questions in this domain. This slide illustrates how the core signalling questions concerning inappropriate exclusions can be modified. This is done by deselecting the third core signalling question, did the study avoid inappropriate exclusions, selecting the Add User-Defined Signalling Question button, adding more detail to the signalling question, and clicking the OK button. The core signalling question concerned with avoiding inappropriate exclusions in the patient domain has been modified accordingly. Note that again, for consistency, a yes response to the tailored question would indicate a low risk of bias. Domain 4 of the QUADAS-2 checklist, Flow and Timing, is another example of a domain where risk of bias core signalling questions often need to be tailored to provide review-specific guidance. For example, it is often necessary to define what would be considered an appropriate interval between application of the index test and the reference standard. A definition of an appropriate time interval will depend on the natural history of the target condition, for example whether the disease is likely to resolve spontaneously or in response to treatments that might be administered in between application of the index test and the reference standard. The definition of an appropriate interval will therefore be review specific. In the heart failure review example, this signalling question would need to be modified to reflect the fact that heart failure is a fluctuating condition and treatments may be initiated which may cause temporary resolution of symptoms. So selecting the Properties box for this domain. The question, was there an appropriate interval between index test and reference standard, can be modified to add extra detail specific to the review topic. In this example, the interval between index test and reference standard may be considered appropriate if it is 48 hours or less. The previous slides have illustrated how generic signalling questions can be modified, usually by adding detail. Another type of tailoring is to add new signalling questions. The heart failure case study includes two index tests, a blood test, brain natriuretic peptide, and the electrocardiogram, the ECG. The review may therefore include studies that evaluate both index tests in the same patients. In such studies, the results of each of the index tests should be interpreted independently and blind to each other to reduce the risk of bias. A signalling question could be added to the two core signalling questions in the index test risk of bias domain to ensure assessment of this aspect of study design. So clicking on the Properties icon again, we want to retain both core signalling questions in this domain, and so neither of these core signalling questions are deselected. An additional question can be created by clicking Add, typing in the additional question required, and clicking OK. There is now an additional item in the index test risk of bias domain. If patients received both BNP and the ECG, were the index tests interpreted blind to each other? More rarely, tailoring QUADAS-2 involves removing core signalling questions altogether rather than modifying them. For example, if at protocol stage a decision had been made to exclude diagnostic case control studies, the second course signalling question in the patient selection domain would be redundant. Clicking on the Properties box of Domain 1 again, the case control signalling question can be removed by deselecting it and pressing OK. Domain 1 no longer includes the case control design study question and contains 2 rather than 3 course signalling questions. So far we have considered how risk of bias signalling questions in the 4 QUADAS-2 domains can be tailored to reflect a specific review topic. The applicability sections of the QUADAS-2 domains do not contain course signalling questions and all require modification to assist with making a judgment of high, low or unclear concern about applicability. Review-specific guidance for judging applicability should be made with reference to the review question. For the patient selection component of the heart failure case study, the important patient characteristics included patients suspected of having heart failure in primary care, with or without symptoms, and prior tests to include clinical history and examination only. So clicking on the Properties icon, user-defined questions can be added reflecting the patient characteristics in the review question. For this example, the applicability signalling question could be modified as follows. Were study participants symptomatic or asymptomatic patients presenting in primary care with prior testing restricted to clinical history and examination? Assuming a study provides the following detail about patient characteristics: 817 adults, of which 800 are symptomatic and 17 asymptomatic, assessed in hospital outpatient departments. This information would be entered into the free text box and form the basis of the judgment about applicability for this domain. Recording the text on which judgments are made also provides transparency of quality assessment decisions. The applicability question added in the previous slide is presented here. Take a few minutes to consider whether the response to this applicability signalling question would be yes, no, or unclear concern based on the information provided in this slide. The answer to the applicability signalling question for this example would probably be no, on the basis that patients presented in hospital outpatient departments rather than primary care. Note that authors can add as many additional questions as they feel necessary to help with a final overall judgment about applicability. However, the wording should ensure that a positive response, yes, indicates a positive study characteristic, that is, one that is consistent with a low concern about applicability. In addition to risk of bias and applicability tailoring, Index Test Domain 2 can also be tailored to cater for reviews that are evaluating more than one index test. Clicking on the Index Test Properties icon, review authors are provided with 3 index test domain sections that can be tailored: the risk of bias section, the concern about applicability section, a section which allows additional index test groups to be defined. In the heart failure example, there are 2 index tests: the electrocardiogram, the ECG, and serum natriuretic peptides, BNP. Test groups can be added in the Test Group section by clicking Add and inserting the names of as many index test groups as required. The QUADAS-2 assessment form and review manager will then contain signalling questions for each index test added. These can be further modified independently for each test as appropriate by clicking on the Properties icon adjacent to each index test type. Moving from multiple signalling question responses to an overall risk of bias judgment in each domain is part of the tailoring process of QUADAS-2 to particular review topics. If response to signalling questions in a domain are consistently yes, consistently no, or consistently unclear, moving to a domain-level judgment about risk of bias is relatively straightforward. Review-specific tailoring of domain-level judgment decisions is required for the situation where any one signalling question is answered no. If any one signalling question is answered no, this flags the potential for bias. Review authors must decide on what basis a judgment of high risk of bias might be made under such circumstances. For example, rating of one signalling question considered an important source of bias, no, may be sufficient for a judgment of high risk of bias to be made. However, for signalling questions considered less important sources of bias, several no scores may be considered necessary for a domain-level judgment of high risk of bias. As an example of moving from core signalling questions to domain-level judgments about bias, at the beginning of the lesson we looked at how we might score signalling questions for the patient domain risk of bias section using the heart failure example presented on this slide. The conclusion we drew was that for this particular study, all risk of bias signalling questions would be scored yes. Based on the guidance presented in the previous slide, this would lead to a judgment of low risk of bias for the patient domain level for this particular study. We are now going to consider issues that are important when presenting the results of quality assessment. Different QUADAS-2 domains are likely to be considered more or less important as potential sources of bias and applicability concerns depending on the review topic. Review authors need to consider the relative importance of different sources of bias and applicability concerns when presenting their results. An overall quality score for each included study is not recommended. Review authors are encouraged to provide a narrative summary of the more important risks to bias and applicability to accompany summary graphics and for inclusion in summary of findings tables. Note that Module 8 of the Cochrane DTA online distance learning materials includes an overview of methods for the interpretation and presentation of the results of DTA reviews, including incorporation of quality assessment. Review Manager generates two types of summary figure. The risk of bias and applicability concerns graph is a cumulative bar plot across all included studies. Risk of bias and applicability concerns graphs can also be produced for subgroups of studies, for example for each index test where there is more than one index test in a review. The risk of bias and applicability concerns summary depicts risk of bias and applicability concerns ratings for each included study. As introduced at the beginning of the lesson, quality assessment of DTA studies with QUADAS-2 includes both assessment of risk of bias and concerns about applicability. Text which forms the basis of quality assessment decisions and is recorded to provide transparency to quality assessment decisions is automatically used to populate study characteristics tables for each included study in RevMan. So in summary, the take-home messages for this lesson are that quality assessment of DTA studies encompasses both assessment of risk of bias and concerns about applicability. The review-specific nature of quality assessment in DTA reviews requires tailoring of the generic tool, QUADAS-2, for each review. Review authors are encouraged to consider the relative importance of different quality domains for their particular review topic when summarizing the results of their quality assessment. Quality assessment should be supported by both graphic and narrative summaries, emphasizing the QUADAS-2 domains that present the highest potential for risk of bias and concerns about applicability.